My name is Dr. Venkatesh Y, Senior Consultant Neurosurgeon, Sunshine Hospitals, Secunderabad. Today I am talking about brain tumors. What are brain tumors? What are the causes for brain tumors? What are the symptoms with which the patient with brain tumors presents? What are the different diagnostic modalities available to detect these brain tumors? And finally, the treatment part. So let us take each one separately. What are brain tumors? Brain tumors are tumors arising in the brain. These tumors can be classified as benign and malignant. Benign tumors are not cancerous and malignant tumors are cancerous. Now there are different types of malignant tumors, different types of benign tumors. Benign tumors have a very good prognosis, and malignant tumors, as they are cancers, the ultimate outcome and side of the treatment vary from tumor to tumor. Now what are the causes for these tumors? Brain tumors, unlike like lung cancer, that many times we know that lung cancer is associated with smoking, excessive smoking, some intestinal tumors or gastric tumors related to eating a lot of spicy food and such things. We know that there are so many other types of cancers where some viral infections are implicated. But for brain tumors, we do not know the exact cause, what is causing them. But the basic pathology or basic reason why a tumor occurs, not only in the brain, everywhere in the body, is because of some genetic changes which occur within the cell, in the single cell, where there is genetic change in the DNA called as a mutation, which causes the cell to grow and divide multiple times without any hindrance to form. One cell will convert itself into 2 into 4, 4 into 8, like that it goes on multiplying, and there is no stoppage for that. This cell is also known as an eternal cell, means these cells which transform themselves into a cancer cell or a tumor cell, they keep on dividing, and ultimately one cell will lead to so many cells coming together and forming a tumor or a mass. Why this happens? Whenever there is a mutation in the DNA, normal cells have on and off, switch on and switch off mechanism about their division or their growth. Whenever there is requirement for the cell to grow, the cell will grow. Whenever there is a requirement for the cell to divide, the cell divides. After the cell division is over, in a normal cell, the cell will stop dividing further because when it is required to divide only, it will divide. Whereas in the cancer cell, what happens is whether it is required to divide or not, it is required to grow or not, it keeps on growing and dividing. So this is the switch off mechanism which is there in normal cell after a proper division is absent in the cancer cell. So the cancer cells or the tumor cells keep on dividing, and ultimately they achieve a big size and they start compressing on surrounding tissues and cause problems. So in brain tumors also, the similar mechanism happens. There is a DNA change or the mutation in the nucleus of the cells, and this leads to uncontrolled mad replication of the cell continuously without any hindrance, and this leads to a tumor. Now, having said that, this is a mechanism by which a cell changes itself from a normal cell to a cancerous cell or a tumor cell. But there are so many checks and balances in the body. As soon as there is a DNA change or a mutation in a cell, the immune system in the body will start seeking this abnormal cell, and the immune system will destroy this cell. But then how then these tumors come? Whenever this immune system is incapable of detecting these kind of cells, or the immune system is weak enough not to destroy these cells, or the cells which have undergone these changes, the DNA changes or the mutation changes, or so many in number, the immune system is not able to eliminate all of them. So there is an imbalance between the formation of the cancerous cell or a tumor cell and the immune system which destroys it. So if the immune system is good enough and it can destroy all the cells which are converting it into cancer cells, then there will be no cancer. But sometimes what happens is number of cells which are transformed into cancer cells are so many that the immune system is not able to handle them, and so some of these cells will not be eliminated by the immune system, and therefore those cells will start replicating fast and they form a tumor. So that means there are two reasons. One reason is the cell itself changes its quality from a normal cell to a tumor cell. The second is the immune system fails to detect all the abnormal cells and eliminate them. So when there is a imbalance between these two processes, then the cells which have transformed into tumor cells will start replicating and form a tumor. Then what are the actual reasons why these DNA changes happen? In the body, every cell, according to the need of the body, it will divide. For example, skin cells divide almost every day, and every day new skin is being formed and old skin cells are dying. Similarly, in the intestines, new cells are being created and old cells are dying. So similarly in the blood cells, the RBCs or the red blood cells die every 120 days and new RBCs replace them. So there is division going on in every cell in the body as per the requirement of the body. So there are three major reasons why these cells undergo some kind of changes. This is called as carcinogenesis, the formation of a tumor cell from a normal cell. How it happens? There are multiple reasons, multiple stages from which a normal cell will convert itself into a tumor cell. Now, for this, there are three major reasons. One is called as the physical oncogenesis, wherein we are exposed to physical agents like ultraviolet rays or X-rays or such like smoke or pollutants. These are all physical in nature. The second type is chemical carcinogenesis. Chemical carcinogenesis is some people working in certain areas like some azo dye industries case, they develop bladder cancers and all that. So that is called a chemical carcinogen. And viral oncogenesis. Viral oncogenesis means wherein the viruses will attack the body and they incorporate their DNA into the host cell DNA, and then they start replicating very fast and forming a cancer. So there are certain viruses like Epstein-Barr virus can cause what's called as a lymph node or a lymphoma, where lymphatic cancer. So for all these tumors, these three are the major reasons. For physical oncogenesis, there are physical agents which cause continuous irritation of a cell and make it to change. For example, sunlight exposure continuously to the skin cells can change the quality of the normal skin cell and form what is called as a melanoma, or a melanocyte will change itself into a melanocytic cancer cell. Similarly, chemical carcinogens, as I was telling you, people who are working in industries which use azo dyes or aniline dyes, there are bladder cancer. Then there is viral oncogenesis, wherein some types of blood cancers are related to viral infections. Now, having said this, where do we stand with this kind of theory or with this kind of oncogenesis? Oncogenesis means formation of a tumor in case of brain tumors. So far, we don't have very concrete data about exact beginning of this cancer cell transformation. So that's why not many physical oncogenes or chemical oncogenes or viral oncogenes we know which can cause brain cell to transform. Now in brain we have two different types of cells. One is the neuron cells, which are the main cells of the brain, which carry the information, the thought processes, the idea formations, the conversion of thought into action, like movement of the body, movement of the limbs, writing, reading, all these skills, everything is carried on by the neurons. The other cell is the astrocyte. Astrocyte is a cell which supports these neurons. It provides nutrition to the cells of the neurons, and the neurons are the basic unit of the brain and nervous system, but the supporting cells, astrocytes, are very, very important, and these support the neural cells and they give them nutrition and they keep them healthy. Now, the tumors which come in the brain usually come from the supporting cells called as astrocytes, and neurons usually don't replicate. There are neurons, after they form the nerve cells will not divide. So tumors usually arise from those cells which divide. So that's why neuronal tumors will not be seen. Usually the cells which divide and form tumors are astrocytes in the brain. That's why we call them an astrocytoma. And there are certain cells which are deriving from the covering membranes of the brain called as arachnoid cells or arachnoid cap cells, from which certain tumors called meningiomas come. They are benign tumors. Astrocytomas are usually malignant or cancerous, and meningiomas are benign or non-cancerous. Now, whenever a patient has a brain tumor, what are the symptoms the patient will suffer from? Normally, whenever the cell changes its genetic makeup and it starts dividing and forming a cancer or a tumor, initially when the first cell divides and to form 2 become 4, 4 become 8, 8 becomes 16, like that exponentially it keeps growing. At the same time, the immune system also is trying to kill off these cells which are transforming. So there is ultimately it's a battle between the transformed cell and the immune system, and after some time when the immune system fails for whatever reason, or the cancerous cell becomes or the tumor cell becomes so very aggressive that it becomes a tumor finally. So what happens is, usually in the initial stages there will be no symptoms because the cells are very, very microscopic. One cell becoming 2 or 4 or 8 or 15 or 16 or 32 doesn't make much of a difference to the patient's well-being. But as the tumor increases in size, it becomes 1 centimeter. Once it becomes a 1 centimeter tumor, to become 2, it will take the same time as one cell dividing into 2. So it is called a tumor doubling time. So 1 centimeter tumor becomes 2, 2 becomes 4, 4 becomes 8, like that. The tumor doubling time is almost constant usually. That means one cell becoming 2 cells, if it takes say about 4 days, 4 cells to become 8 will take the same amount of time. And the other factor I told you is the immune system. The immune cells which come and kill these cells, so will limit the progression. But it cannot be for very long, and if the cancer cell is very aggressive, it becomes very fast growing, and ultimately a tumor of size of 2 or 3 centimeters will form, and some 4, 5, 6 centimeters also. A big tumor will start compressing on the surrounding brain structures and the patient will start getting symptoms. So the major and most important symptom which comes in a patient with brain tumor is a headache. Headache is very, very common in patients with tumors, and almost 90 to 95% of the patients with brain tumors get headache. If the tumor is big enough, then it starts compressing on normal structures around that tumor in the brain, and that will cause what is called raised intracranial pressure, which leads to that headache, followed by vomiting and sometimes blurring of vision, because the pressure is transmitted to the optic nerves, that is the vision nerves from which we see, and then they will have blurring of vision. After the vomiting, usually the headache will improve, it becomes better. So these are the symptoms which are very, very common, like headache followed by vomiting and blurring of vision. And once the vomiting is done, once the vomiting is over, the patient feels slightly better. This is one very common symptom. Almost 90 to 95% of the patients with tumors will have this symptom. The second very common symptom, apart from headache and vomiting, is what is this? Fits, epilepsy. epilepsy, seizures. So if the tumor is in such areas where it irritates the motor area, see, the right side of the brain will control the left side of the body. Usually the motor area means from where we get the movements. The nerves which are meant for the movements of the left side of the body are situated in the right side of the brain. Similarly, the left side of the brain controls the right side of the body. So whenever there is a tumor in that motor area, there is a chance that the patient can develop fits and also sometimes some paralysis, or when it presses on the normal structures of the brain, whichever structure it is pressing, the tumor is pressing or invading the tumor in that area, that particular area's work or function will be lost. So for example, if there is a right-sided tumor which is sitting on the motor area or the nerves which supply the left side of the body, then they will develop left-sided hemiplegia, or also called as left-sided paralysis. Similarly, if there is a tumor on the left side, then there will be paralysis on the right side. And also, if the tumor is on the left side near the speech area, the person will have speech difficulty. Sometimes they will have difficulty in articulating, or they will have stammering kind of things. Sometimes they will not know which word to use. Sometimes there will be complete failure of speech if it is in the speech area. Similarly, if the tumor is in the area where the speech is understood, then they will have what is called a sensory aphasia, or they cannot understand what we are speaking. If the tumor is in an area where it is meant for vision, for example, the back of the brain, then they'll have visual disturbances. So the common symptoms are headache, vomiting, blurring of vision, fits. Then depending on the site of the tumor, which part of the tumor is which part of the brain is compressing, based on that, patient can develop paralysis of one side or two sides, or sometimes paralysis only upper limb, sometimes paralysis face on the upper limb. Sometimes it will be like lack of speech. Then apart from this, they can develop even what is called as giddiness or dizziness. So these are the common symptoms. Sometimes they even have problems in thinking. They'll have memory disturbances depending on which area. Memory area is involved, they'll have memory disturbance. If the thinking, a thought process area, abstract thinking, left side frontal lobes are involved, there will be abstract thinking problems. Like that, each area will have its own function in the brain, and that particular function will be lost or deranged when the tumor compresses that area or it invades that area. Now, once a patient of this, if this kind of patient comes to us, to the hospital, to the doctors, then what we are going to do? So first and foremost, apart from whatever symptoms I told you, there is also sometimes they come with altered consciousness. See, any tumor anywhere in the brain, it can cause altered consciousness because the tumor presses on the brain structures, and then the pressure in the brain increases, and because of that, many times the consciousness areas will be also involved, and therefore patient will have drowsiness. He's tending to sleep a lot. Sometimes he'll become even unconscious and comatose. So any patient who is having severe headache for more than 2 years, patient who is getting very often headaches with vomitings and blurring of vision, and fits which come after the age of 18 or 20, these kind of patients should approach a neuro specialist at the earliest. Now, when this patient comes to us, what we do? We examine the patient, we see if there is any weakness in one side of the body, whether there is speech disturbance, whether there is any hearing disturbance, whether there is any giddiness complaints, what the patient has, and then we see whether he is having more drowsiness, or he is tending to sleep more, or he is in coma also sometimes. So in such patients, we examine the patient thoroughly, neurologically. Then the best diagnostic modalities are to identify this, what is the cause for this drowsiness, or cause for this speech disturbance, or cause for this paralysis. We get a CT scan or an MRI scan, and then on the CT scan or MRI scan, we can identify the tumor. But usually, if the initial diagnostic tool is CT scan, in spite of that, we do an MRI scan, because MRI will give us more information regarding the vascular supply or the blood supply to the tumor. And it can tell us whether the tumor is infiltrating the brain or it's only compressing the brain. The MRI can even tell us sometimes what we call as MR spectroscopy. We do it. There is a special modality test called MR spectroscopy, by which we can even identify whether this tumor is a benign tumor or is a malignant tumor. After we identify the tumor, what next? Now, once we identify the tumor, we have to do something about it, because the patient is suffering from the disease. He is having symptoms, he is having problems to function as a normal human being. So therefore, we have to do something about it. Now, what are these treatment modalities that are available for us? If the brain tumor is very small, suppose sometimes it's coming from the hearing nerve, and the patient is aged 70, 75, he is not having much problem with this. He is only having tinnitus or some ringing of the, something like ringing sensation in the ears, and sometimes he may have some hearing loss. If such a patient comes to us and we identify this tumor, usually it is called as a CP angle tumor, or a acoustic schwannoma we call it, or a vestibular schwannoma. In such patients, they'll have some hearing disturbance. They'll have sometimes they can have tinnitus. Tinnitus is ringing sounds in the ears, and sometimes even they can have giddiness. So when such a patient comes to us who is 75 plus and he doesn't have really any other problem except this. So many times we just observe this tumor. If the hearing is too much deranged, then we'll do a surgery and remove this tumor. So in brain tumors, we have mainly three different approaches. First approach, as I told you, if it's a very elderly person and the tumor is very small, it is not causing much problem, then we can observe it. Observation is also one of the accepted treatment modalities wherein we observe, because to remove a tumor again we have to do a major surgery, and if it is not causing much problem, we can just observe this tumor. If it is very slow growing, it may not cause much problem for the next 3 years, 5 years. Patient is already 75-year-old, elderly gentleman having other ailments like heart ailment, BP, sugar and all those things. So we can observe this patient every 6 months or a year. We repeat a scan, or we continuously, the patient can follow up with the doctor or the neurosurgeon, and whenever there is a major problem, he can approach the doctor and then we can go for a surgery. The second approach is, if the tumor is more than 3 centimeters, 2 centimeters, it's causing problems like fits, it's causing severe headaches, the patient is having drowsiness, paralysis on one side and speech difficulties. In such a patient, we have to do a surgery and remove these tumors. And third is where there are some tumors which are inaccessible areas, where we can just take a stereotactic biopsy. We take a biopsy, prove what the tumor is about, whether it's a benign tumor or a malignant tumor. Then we can give what is called as radiation. So most of the benign tumors like meningiomas and Akosha schwannomas, we can do surgery, remove them completely. That is, we can achieve a cure also. And in malignant tumors, there are different grades, grade 1, 2, 3, 4, or WHO grade 1, 2, 3, wherein WHO grade 1, grade 2, grade 3. In grade 2 and grade 3, we give radiation chemotherapy also. And certain tumors called glioblastoma multiforme, which are also called as grade 4 tumors, usually the length of survival after detection of the tumor is hardly about 9 to 12 months, in spite of all our efforts. So, but some patients in that also, up to 20% of the patient, there is survival of almost 5 years. What we have to see in brain tumor surgery is to give a good quality of life, not only the longevity, but quality of life. Suppose we do a surgery and patient lands up in a coma, or he becomes completely paralyzed and invalid, then it is not going to be very good for the patient. So brain tumor surgeries done with a high degree of responsibility, wherein we should not make a patient worse than the disease itself. We have to give him very good quality of life after the surgery. Otherwise, this surgical procedure has no meaning. So when we are doing a brain tumor surgery, the surgery is done in such a way that we have to preserve the normal brain parenchyma, we have to preserve the blood vessels, the arteries and the veins, we have to preserve the nerves, and without actually causing much problem to these structures, we have to remove the tumor. So in malignant tumors, after the surgery, we have to do radiation, chemotherapy. In benign tumors, the removal of the tumor itself can be curative. Sometimes in very difficult areas where the tumor is very vascular, in such a situation, we do maximum tumor removal, and the remaining residual tumor we can go for radiation and follow up of the patient. Thank you.